An abdominal hernia is a break in the abdomen. It's a tear where the intestines or the abdominal contents come out through that tear. The formation of abdominal hernia can be have several factors. One of them is obesity. As the patient gets more obese, it puts more pressure into the abdominal wall. The abdomen is like a balloon. If you inflate a balloon as much as you can, the balloon will eventually pop. Same thing happens with the abdomen. I've seen that patients who are super obese, they just start breaking the abdominal wall and then the hernias start to come out. But a second factor is when you have had surgeries, once they close your abdomen, the repair of that old surgery you had is not as strong as the original tissues. So eventually, patient, as they get older, or they lift heavy, or they gain weight, that repair of the abdomen can eventually break and form a hernia. And the third factor is actually having a simple cold and persistent cough that can produce some breaks in the abdomen, mostly around the umbilicus. I've seen many patients that after a severe cold and a severe coughing can form hernias. The symptoms of an abdominal hernia are usually a bump. Patients can feel a bump in the abdomen and pain. Depends on where the hernia is located. You're going to find that this bump or mass is coming out. For example, around the umbilicus, a patient does not have an innie anymore. It has not more than an outie. They have a mass that is quite noticeable. If it's in the groin, you will see a symmetry of the groins. Where the hernia is located, you're going to see a mass in that region. And if you have a hernia in an area where you have had surgery, then you're going to definitely find a lump that's coming out underneath the old scar where you had your surgery. The way to prevent a hernia is, number one, don't gain weight. As we get older, it's easier to gain weight. So if you can control your weight to the ideal numbers, that would be great. But the second way is not to lift heavy. I see people that go to the gym and start squatting 300 pounds. That is unnecessary in every sense, really. The third factor is if you have a severe cold and cough, take medications to try to suppress it, and you will prevent some of those hernias that come with severe coughs. The main reason why you want to fix a hernia surgically is because if the hernia is not repaired, it will continue to grow. And the greatest complication is when the hernia produces incarceration of the intestine, or even worse, strangulation of the intestine. If you suffer from a strangulated hernia, then it becomes a complex surgery and really a catastrophe. It can put even the life of the patient at risk. So hernia should be repaired in a preventive form so that they don't continue to grow, and then you can prevent those two major complications of incarceration or strangulation. The treatment of hernias is always surgical. There's no other means, there's no medicines, there's no binders that you can put in there that you will treat the hernia with. The hernia of any size, on any patient, on any age, will require surgical repair to relieve symptoms as well as to prevent complications.